This is still your regular anchor, your public health experts. I still remain additional Adelani, an epidemiologist, also a nutritionist. Today is World Hepatitis Day. It's usually observed in July 28th of every year, where we discuss on how we can mitigate or prevent having hepatitis. The theme of this year's day is also let's break it down. We're looking at some statistics over the years. In the year 2024, for example, 287 million people were living with chronic hepatitis B and C. Also in year 2024, only 45% of babies receive hepatitis B vaccine within 24 hours of birth. Also in year 2024, 1.3 million people died of chronic hepatitis B and C in the year 2024. You can see those statistics. We can reduce it to the barest minimum. That is the reason why there's need for proper campaign on this deadly disease. As I've said earlier on, I said it's usually observed on the 28th day to raise awareness of the viral hepatitis. It's an inflammation of the liver and it causes severe liver disease and liver cancer. So there's need for us to eliminate the viral in the society completely for us to live a more healthy life. So today's World Hepatitis Day, we're looking at the various ways in which we can reduce to the barest minimum, leveraging existing science and policies. That is, there's need for effective vaccines, accurate diagnosis, and curative treatment for hepatitis B and C, and the long-time therapies for hepatitis B are already available and proven. These tools prevent infection, interrupt transmission, and save millions of lives by reducing liver disease and liver cancer. So our priority now is to ensure these interventions are scaled up and equitably delivered to all who need them, which requires strengthening political commitment, investment, and accountability. Another key message we need to put into cognizance is we should put people and communities at the center of hepatitis elimination. That is, lasting progress depends on the leadership and participation of people affected by hepatitis. When communities help shape policies, programs, and services, the response becomes more effective, accountable, and responsive to people's needs. There's need for us to also ensure equitable access to hepatitis services for all. That is, everyone needs to be able to benefit from World Health Organization recommended hepatitis prevention, testing, treatment, and care services, expanding access for undeserved and vulnerable populations through people-centered integrated service delivery, and it's usually essential to reducing inequalities. So there also need for us to reduce inequalities, gender biases, and lots of more. Then it's also looking at integrate hepatitis services into universal health coverage. So there's need for us to integrate it into our universal health coverage. Hepatitis services should be embedded with primary health care. All our primary health care centers should embed those tests and prevention measures campaign should be carried out majorly from those centers. And universal health coverage systems that prevention, diagnosis, treatment, and care are available throughout the life course. So a multi-sectoral human rights based approach is essential to address barriers to access. That is, accessing those primary health centers is also a key for our people. Then there's also need for us to accelerate research and innovation. That is, we have the opportunity to change trajectory of viral hepatitis by investing in research, development, and innovations for the prevention, detection, and treatment of viral hepatitis, particularly hepatitis B and hepatitis D. Is a co-infection. That is, it does that if someone has hepatitis B, it now migrates to hepatitis D if it's not treated. And you can imagine the liver is going. So, and we don't pray for such. So there's need for us to detect hepatitis B early in all our primary health centers and innovate, spend more on research and innovation than to reduce the spread of hepatitis in the whole world and most especially in Nigeria at large. And fostering collaboration across sectors, countries can improve outcomes for millions of people. So those are the areas we think we should this year try and improve on in our health sector, especially in Nigeria. Our people should go for testing early when they are exposed, and there will be more, the treatment will be faster than normal than it should be. So I think I've done justice to that, and I pray next year there will be more insights in how people can reduce and prevent from having hepatitis. Thank you, my viewers. And my next edition, I'll be talking on various ways in which you can prevent hepatitis and how we can take vaccines in preventing hepatitis. Thank you very much. God bless you.